most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to fix a pulled or strained muscle. We got the best home protocol for fast recovery.
That's right,
We're going to
Bob.
go step by step, right, Brad?
Exactly, Bob. Any muscle in your body.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day.
That's right.
Also, go to bobandbrad.com. We're giving away something amazing here, folks. We're giving away a Sleepovation mattress.
Yes.
This is not the mattress. This is a sample of the mattress. It's much bigger.
Yeah.
It's got the normal sizes.
Regular sizes.
So go to bobandbrad.com. Go to the giveaway section. You'll find the contest there. You can also find it on Facebook. It'll be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. Really quickly about the mattress. 700 individual mattresses it has. It has channels, air channels. Very comfortable. A lot of people think it looks too soft. It is not. It is still, plenty firm.
Yes.
You were also going to give away a couple of Sleepovation pillows. Here's the full one. And here's the cross-section one. It actually has springs in it.
Yeah, but you cannot feel them
You
whatsoever.
cannot feel them at all. A really good, I think, sideline pillow,
Yeah,
Brad.
yeah.
I don't like it as much for lying on my back.
Yeah.
But really good for sideline, which I tend to do.
Very good, Bob.
Okay, can we go on?
Next topic, the main one, pulled or strained muscles. I would have to say, Bob, everybody has had a pulled or strained muscles.
I'm
throughout
in that
their
camp
life.
many times.
I can honestly say I've been pulling my hamstrings more in the
Yeah,
last 2
yeah,
years
yeah.
of my life than ever before.
Yeah.
So I'm learning how to manage them. It is different when you're doing it to yourself versus a patient. It's a little more.
And you're older, Brad.
Yeah,
I mean, I hate to say it, muscles don't heal as fast when you get older.
Exactly right. So we're going to talk to you about how to manage and improve a pulled muscle fast.
Sure.
As fast as possible anyways. First of all, you're going to protect it. When you pull a muscle and it hurts and you can push on it, like in my hamstrings, I can push and find that tender spot. When you walk, it hurts. You just got to give it a break. Don't start stretching it.
Yeah, don't stretch it right
You
away.
think, oh, it's a pulled muscle, I got to stretch it and get it to relax. What happens is you've got the muscle is, let's say these are the muscle fibers. We stretched it, strained it, and if you tore it, the muscles actually came apart. But let's say it's just a strain or a pretty strain.
Or some micro tears.
Yeah, micro tears. And if you stretch it, you're just making it worse.
Right.
We need to give it a rest. Cold pack, use some NSAIDs, ibuprofen as
non-steroidal anti-inflammatories.
right. And usually, you may know what works for
Drugs.
you, or call the doctor.
Right.
Or a pharmacist, they can give you some information.
That whole thing, when you're pulling it, stretching it, you can also be disrupting blood vessels that were already disrupted.
Right.
You know what I mean? So
make it worse.
Make it worse.
Do not start out stretching right away.
Right.
Let it settle down. And it may take one day to settle down. It may take a few days depending on the severity of it. Just go by what your body tells you. With my hamstring, I was limping the one time I pulled it. So I didn't start stretching until after I could walk without pain. And
Gotcha.
that took a few days at one time.
Well, a few days, or it could be a few weeks.
Yeah, it could be. If it's a tear, I didn't put tear in the title because tear is a big difference between a strain or a pull. If you actually tore the muscle and it's separated.
It's all degrees.
Right,
There's
it
first degree, second degree, third degree
Exactly.
strains, and there are probably some tears there.
Yeah. I mean, when the muscle rips completely
Right.
apart.
That's a whole different story.
That's
surgery.
time to go to the doctor.
Right.
Okay. So we're going to just give it some rest. Now, when you can start to feel it, let's say it is the hamstring, and you can start to press in there, and it's not so tender anymore. You can start to walk without the pain. Then it's time to get in and start doing a massage on it. And on a muscle, the fibers run a certain direction, and the hamstring is vertical. If it's a bicep, they run this way. I'll go to the bicep. It's easier. You're going to start doing a cross friction massage.
So you're going to cross the fibers.
Yes.
To massage it.
Right. You're not going to do it if you start doing it and it hurts and it continues to hurt and it gets worse after about 20 seconds. Too early.
Right.
On the other hand, if it hurts at first, but after about 15, 20 seconds, it starts to feel better. It's like, oh, it's better. That's when you're going to continue with the cross friction.
I'm going to say this
massage.
also, Brad.
Okay.
Some just about gentle massage. Like, let's say the tear is right here.
Yeah.
If it hurts right on the tear, maybe you could work around it first
There
to
you
start
go.
off with. You
Right.
could go above, below,
Exactly.
and work around. Because anytime you can start getting blood flow to the area, it's usually going to help heal it.
Now, if it's a small muscle, like let's say if it was on your wrist,
Right,
you
or
know,
forearm.
a lot of time you can massage it easily with your other hand, but your
Yeah.
fingers get tired after a few minutes, and then you had enough. But if it's a larger muscle group, for example,
Yeah.
hamstring, which is probably one of the most commonly pulled muscle. Man, I'm doing this to myself just recently. It's like, oh, it's a big muscle group. I'm getting really tired.
And you don't feel like you're doing anything.
Right.
Quadricep,
Yeah. So
calf muscle. I
these
think-
big muscles, if you are inclined to do so, or you may already have a massage gun.
Yeah.
Yeah. And so let's,
Big
Yeah.
difference. Really makes a big difference. And these guns have really come down in price now. They used to be $400, and now they've come down to, well, they vary, but
Yeah.
like 150.
right. They're
So-
much more reasonable. And you can use them for not only pulled muscles, just sore and tired muscles
Right.
to increase circulation.
It's nice to have one on hand, especially in your family.
Yeah.
Because you'll be passing it around generally.
After be fighting over the massage
This
gun.
comes with 5 heads. So what's nice about this is you can almost every situation you have, it can be accommodated by
Right.
the different heads. So this was more of an air filled, but you used the pointer one.
Right, because I want to get into a deep muscle, and I really, I would say I'm sold on this, Bob, because I start using this, it
Sure.
saved my fingers, and it really gets into that muscle. I'll show you how I'm using it on my hamstring. Let's get this going. It has 6 different levels of intensity. I've been putting it on number 4 or number 5. And what I would do is I would get into that hamstring, and I thought it was getting better. As a matter of fact, right now, I can find the tender spot. It's much harder. But when I first started doing this with my hands, it was harder to find the tender spot. So I thought, I'm healed up. I'm doing good. I can start running more aggressively. Then I put the massage gun, and it's like, whoa.
Different story.
Yeah, it's getting in there and it's hitting the injured spot. And each day I'd get that spot, and it was getting better because the massage gun or your cross friction is breaking up scar tissue. And that's what
And
we want to
helping
do.
it heal stronger.
Right.
Hamstrings, by the way, yeah, the tear tends to be either mid hamstring or up by the butt.
Right. And
So-
mine actually is kind of medial, which is a little unusual.
Oh,
But
sure.
one way or another, I was able to find the fibers that are irritated and healing, breaking up the scar tissue. And usually I go about 3 minutes or so with
You
this.
got to show them the name on the massage.
I'll
gun.
let it. I was going to be modest, Bob, but if you look, it's kind of small. Zoom in on that. We like this massage gun so
Yeah.
much. We got our names put on it. It's a great gun,
Yeah,
great
it's
product,
great.
and it's a really good price.
Yeah,
Um,
pretty silent too.
so you're going to use, if you are using that or using your hand, you're going to continue, even if it's feeling better, continue to do it for maintenance program, and it really does. I find it very invigorating. It feels great.
Well,
when we're
Brad and I
done.
just talked about this. One of the thing is, and we'll talk about this a little bit later too, but I think the timing of doing the massage, a lot of times when you start getting back into activity,
Yeah,
I do massage on the muscle before I do activity.
good point.
Really stretches the muscle.
Yeah.
I almost a lot of times don't even need to stretch it then.
Sure.
Because the
Yeah.
massage has stretched it. And you're just so much more ready for the activity. And also then you're much less likely to injure it again.
Right. Now, one thing I've been doing massage gun, and then I actually do a stretch after I massage it, and it's been doing very well. So
Sure.
you kind of have to
Yep.
experiment with your body and which muscle group it is.
Really got to listen to your body on these pulled muscles.
Exactly right. And then it's like, when do I start, in my case, running? When do I start running again? Because that's the activity that I irritated it. I pulled it while I was running, but I want to get back to running. So how do I get back for, it's walking, it's working well, and then I want to get to that running. So I started walking, and then I would
Right.
run. I just jogged.
Yeah.
And I could feel it. You know, if it was talking to me, it's like, oh boy, it feels like it could strain again. I back off.
I went through the exact same thing. I tore my calf muscle. Was more on the lateral aspect here. I don't know if it's the perineals,
Sure.
but I would actually get on the treadmill and use my arms, and I would walk, then I would run a little bit with my taking the weight off.
Off your body,
Yeah.
off your foot, yeah.
And then I slowly started adding the weight.
Sure.
And the same thing, Brad. You can tell, like, oh, that's starting to get too much.
That's starting to
And then-
irritate it.
But that probably did more for me to get this thing to start healing. Because if you just go back and start running,
Yeah.
it's going to tear again.
Yeah,
And then you're going, whoa, my God, what is it?
Yeah,
You
we
got to
can-
progress into this.
Exactly. I started to walk, run, and then I started jogging, just jogging a mile. If it felt good, well, then I'm going to jog a little bit further. Now I'm up to a little over 2 miles, and now I actually started to increase the speed. I have to admit, I started to increase the speed too fast, and I ended up walking home.
Imagine that. Imagine Brad Heineck.
Uh,
Brad's got 2 speeds, 0, 150. That's the speed
it
he
is
has.
difficult for me to get this whole progressive thing, and I'm a therapist. I should. It's a personality.
Did
thing,
you
but-
want to mention strain, counter strain, Brad?
Well,
or-
yeah, we can do that, and that can be thrown early on, and you can
Right.
do that when it's. You can do that when it's right away. The reason I held off on that because each strain, counter strain technique is different for each muscle group. If we did all the muscle groups, we'd be here for another couple hours.
Yeah.
But if you want to do the strain, counter strain, which is excellent technique early on, the technique takes 90 seconds. So all of our titles, say you have a hamstring and you want to figure out how to do the strain, counter strain, simple technique, takes just a couple minutes. The treatment is only 90 seconds, but type in hamstring, 90 seconds, calf muscle, 90 seconds, Bob and Brad, and then that will come up.
Exactly. Just put, especially in 90 seconds, Bob and Brad will probably pull up all the titles, Brad.
Sure. And
So
then,
you can look through to see which one is that you're having trouble
right.
with.
Yeah. We'll have to do a playlist or do something perhaps with that so that
Right.
can be
Organized.
We really both have had great success with that particular technique on injured muscle. And the nice thing about it, it doesn't hurt. It's relatively easy to do.
It's a little weird to me that it works as well as it does sometimes.
But it's been studied. It's
Yeah.
been around for over 30 years.
Yeah.
Lots of science studies on it. And so anyways, that is part of this protocol
By
as
the way,
well.
Brad and I can fix just about anything
Except
a
for.
broken heart.
But we'll continue to
The
work
heart's
on
a
that.
muscle, by the way.
It is. I was just trying to
That
imagine.
confused both of us. Why can't we fix it?
We got the massage gun.
all
We got rid of
right.
the rib cage. I
Yeah.
don't know.
All right. Thanks for watching.